Hi, in this screencast, I'll be talking about the administration of IV medications. Some of the advantages of giving medications via the IV route. Well, we use it when we need to give a very precise administration of a medication directly to the bloodstream. If we give it via the GI tract, sometimes some meds can be denatured or are very irritating, and some is lost in the absorption as well. Some medications we need a lot of precision, such as IV insulin, IV heparin, some of the cardiac meds, and so we don't want the medication to go anywhere except directly into the bloodstream. IV medications are good when patients are unable to take PO medications. For instance, if they're NPO, if they have problems with their GI tract that they're not able to absorb medications that way, if they are unconscious, for instance during surgery or in an emergency, this is a good route. It's important when we want rapid drug action, for instance, pain medication or medication for nausea or emergency medications. Sometimes we use the IV route because we need to be able to terminate the administration of the drug rapidly in some situations. For instance, the use of Pitocin in labor to augment contractions. If the contractions get too strong or too close together and the fetus is going into distress, we need to be able to slow down or cut off the Pitocin very quickly. So instead of giving it via the IM route, we give it IV. And some medications we need to give in high concentrations, or we need to make sure that the blood level stays consistent. We'll give it as an IV drip. Again, some cardiac meds, antibiotics, insulin, those are drugs that sometimes we need a consistent blood level. However, there's disadvantages to giving meds via the IV route also. There's a very small margin of error, so we have to be very careful and very precise when we draw up the medication with the speed that we infuse it. We just need to be very careful. If the patient has an adverse reaction to the drug, it can be very sudden and it can be severe because the medication is going directly to the bloodstream. And the patient is at greater risk of phlebitis because medications can be very irritating and can cause chemical phlebitis. And some of them, they are so irritating they're considered a vesicant because they actually cause tissue damage if they infiltrate. And that's what happened in this poor baby's hand. So drug safety with IV drugs is the same as what you've learned for any medication. First of all, before we give a medication IV, you need to review the order and make sure that you're reading it carefully, and review the 5 rights: the right patient, the right medication, the right dose, the right time, and the right route. You need to make sure that the medication hasn't expired. And then looking up the drug information in the drug books, you need to know why they're getting it and if there are any side effects or adverse reactions. And a side effect is something that we know may occur with this medication. An adverse reaction is something that's more dangerous. An example might be with morphine sulfate. A side effect would be complication, and an adverse reaction may be an anaphylactic reaction or dyspnea. And then something that's different with IV medications that you don't necessarily do with other meds is we need to see if there are incompatibilities with the IV fluid. We need to find out what the rate of administration is when we infuse it. And with some meds, we need to dilute them. And so we need to know, do they need to be diluted, and with how much fluid, and with what fluid? And there are special IV drug books, which we have in the lab, and we will practice looking up this information for different medications when we're in the lab. Other considerations with safety is, again, aseptic technique, making sure that you're scrubbing the hub very carefully, that when you're putting tubing into the hub that you don't touch the tubing against anything because it needs to stay sterile. Any bag of medication or syringe with medication in it needs to be labeled before it leaves the med room. And you can see the orange medication label on the IV bag in this picture. And we need to monitor the patient's response a little closer than we would with other medications, especially if it's their first dose of it. We want to stick with them and see how they react to it. So drug compatibility. We need to see if the IV fluid that the patient is getting is compatible with the drug. IV medications are given through IV lines that either have some IV fluid dripping in or a saline lock. And before we attach the med, we need to look up compatibilities. And again, we'll do that in the lab. We'll practice looking some drugs up. You need to be very careful if you're infusing more than one drug at the same time through the same IV line. So an example of that may be the patient has an IV solution dripping in and they have an antibiotic piggybacked onto it. And at the same time, they have an order for morphine IV push, and they want some morphine for pain. And so while the IV antibiotic is dripping in, if the pain medication is compatible with it, we can infuse it through the same line. But we have to be careful with both drugs. Are they compatible with the fluid, and are they compatible with each other? And we never add IV medication to tubing that has blood products or TPN, total parenteral nutrition. If a patient has blood or TPN infusing and they need a medication IV, then we need to use a different port or a different access. They may need to have 2 IVs started. There's different ways of infusing IV medication. There's continuous infusion or continuous drip. There's the intermittent infusion or piggyback. And there is direct injection, which we more typically call IV push. And we're going to focus on the piggyback administration, but I'm going to just touch on all 3. So a continuous infusion is where a patient has a continuous drip of a medication going in until the physician orders it to be discontinued. So for instance, they may be getting a cardiac drug on a continuous drip, or they may be getting Pitocin or insulin on a continuous drip. A continuous infusion would be used if it's a medication that needs to be highly diluted, if it's a medication where we want to cut constant plasma concentration, so again, like insulin. And these drugs always have to be on an IV pump because the administration has to be so precise that you always need a pump. And examples of these medications, as I've been saying, are things like Pitocin, nitroglycerin, insulin, heparin, potassium, are things that may be given continuous drip. Direct injection or IV push. We will focus on that in our next IV lab in third semester. IV push medications are meds that are either undiluted or very minimally diluted, and in Colorado it's not in the scope of practice of LPNs to give IV push medications, and in the second semester of our nursing program it is also not in your scope of practice, so this is not something we will be doing until next semester. So we will focus on an intermittent infusion, also known as IV piggyback, or a secondary infusion. Same thing. So a piggyback infusion is where the medication is added to a small volume of carrier solution, usually normal saline. So you'll have a small IV bag with 25 mLs up to 250. Usually they are 50 or 100 mLs of solution that it's added to. And this bag of fluid is infused over a relatively short period of time, 15 minutes to an hour, hour and a half. And instead of infusing continuously, it's infused at intervals. May be ordered every 4 hours, every 6 hours, every 8 hours, every 12 hours. It just depends on the medication. But we hang it, it runs in over a certain period of time, we discontinue it, and then we hang it again after a certain number of hours. IV piggybacks or secondary lines are always attached to a primary line through a Y port on the tubing. It can also be connected through a pump and given through a pump, but either way it's attached to a primary solution. And so it's important always to check, is it compatible with the primary IV solution that's hanging. And we will practice that in the lab also, looking up compatibility and determining if it can be hung with that. Now, if we find that our medication is not compatible with the solution that's hanging, we need to discontinue the solution that's hanging, flush the line with normal saline, and hang up a bag of normal saline that we can run the piggyback through. All medications are compatible with normal saline, so that's okay as a carrier solution. And I'll show you how to do that in the lab. IV medications or piggyback medications, I should say, come in a variety of packaging. In this picture, the number 1, the magnesium sulfate, comes pre-mixed from the pharmacy, and we just spike it, attach it to the primary line, and infuse it. The other 3 examples, number 2, 3, and 4, are examples where the medication is not pre-mixed. It gets mixed at the bedside. And we see this frequently with antibiotics because once they're mixed, they will expire after a certain amount of time. So they don't want us to mix them until we're ready to infuse them. In the number 2 picture, there's a vial with a cork in it, and we grab it through the bag, or we grab the bag, pull the cork into the bag, and that mixes the solution. We see that sometimes. Numbers 3 and 4 are what we're currently seeing more commonly at our facilities. Number 3, the blue piece on the bottom, a vial of medication would get attached to that, and we mix it in with the normal saline and hang it. And the number 4 picture, you can see the bag. At the bottom of it, there's 2 seams where the bag is fused together, and in between those 2 seams is the powdered medication. And what we do is we roll the bag up from the bottom, and it breaks the seal and mixes the medication with the saline, and we can hang it. And I'll show you some examples of some of those in the lab as well. The actual procedure for hanging an IV piggyback solution is based on the concept of hydrostatic pressure, where the bag that is hanging higher has more pressure, and so that fluid will drip in rather than the fluid from the bag that's hanging lower. So I will show that to you. I'll demonstrate it in the lab. However, you need to go and watch the skills video for hanging a piggyback so you can see all the steps for it before you come to lab. And we'll also show you how to hang a piggyback from a pump when we talk about pumps in the lab. So I will see you then. Make sure and watch the skills video.